This is Miss Wrinklebottom. She is a 50-year-old female with congestive heart failure who was admitted yesterday for an expected exacerbation of CHF and generalized weakness. Today, Nurse Alex is assigned to her care. Let's listen to her morning interaction.
Hello.
Good morning, Ms. Wrinklebottom.
Hi.
I'm Alex. I'm going to be your nurse today. How are you feeling?
I'm not feeling too well. I'm feeling nauseous, really, and I've had leg cramps all night.
Same days. I hate when I get those leg cramps at night.
They're really, Charlie horses are awful.
I know. I hate that because I can never sleep when that happens, and I'm like restless leg syndrome. I don't know.
I was up all night. But can you hand me that basin, please? I'm feeling really nauseous.
Yeah, here. And I'll go get your toothbrush so you can clean up after yourself. I'll be right back.
Okay.
Hello again. It is important to recognize significant assessment findings, whether they are objective signs such as vomiting or subjective signs. Ms. Wrinklebottom saying that she has cramps throughout the night and that she's nauseous. Those are both significant. So assessment findings give you a clue as to what is going on with the patient. Now let's see what's going to happen next.
Oh, Ms. Wrinklebottom. I'm back. Here's a toothbrush and toothpaste for you. Oh, I say you threw up a little bit. That's okay.
I'm still feeling kind of nauseous, but you're such an angel for bringing me this. And it's so funny because you have a halo. Will you please give me some water, though? I'm feeling really thirsty.
Of course. I'll get that as soon as I leave. Oh, I see you didn't pee much last night. Or maybe the aide just emptied it. I'm not really sure. But I'm going to do a quick assessment on you, if that's okay.
For sure.
Well, let's see. Your pulse is above 60, so that's good.
Okay.
Let me look at your feet. Oh, you're a little swollen, but that's normal in people like you.
Okay. You know, you're such an angel. You're so pretty. You make my heart skip a beat.
Oh my gosh.
And like, you take my breath away.
That's so sweet of you. Oh my gosh, we should take a selfie because I just love patients like you.
Sure.
Okay, let's do this. Perfect. Okay, well, let me go get you some meds and let me go get you water and I'll be right back.
Okay.
Okay.
See you later.
Did you see what happened there? A little bit of violation, don't you think? Now, a prudent nurse would notice the early signs and symptoms of Dig toxicity and how the patient commented she was seeing a halo. On that, and on that, an angel of a nurse, you know, seeing the halo, you're making my heart skip a beat, complaining of shortness of breath, all signs and symptoms of Dig toxicity, as well as increased thirst, decreased urine output, edema. She has signs and symptoms of dehydration and decreased kidney function. Let's take a look at her labs. Oh.
Gosh, this picture is going to be so cute on Facebook. I just love her.
Yikes. Those lab values look very frightening. The low potassium, low magnesium increases the risk for digital toxicity. Come on, nurse. The digoxin levels are high, like we expected, and impaired renal function also contributes to the digitalis toxicity. This does not look very good. Will the nurse get back in time?
I guess I should go check on her again. Let's see.
It's so hard to breathe. Hey, Miss Alex.
Oh, hi, Ms. Wrinklebottom. How you doing? How's it going?
I'm having a lot of trouble breathing.
Ms. Wrinklebottom? Ms. Wrinklebottom! Ms. Wrinklebottom! Oh no! No! Come on! Come on!
Now let's see what a prudent nurse would do in this situation.
Hi, Ms. Wrinklebottom. My name's Alex. I'm going to be your nurse today. How are you feeling?
Not very well. I'm feeling pretty nauseous.
Oh, really?
I'm having a ton of leg cramps.
Oh.
They kept me up all night.
Oh, I'm so sorry. Are you experiencing anything else? Like,
Just really bad nausea. Can you hand me that
yeah.
basin, actually?
yes. Oh, here, let me go. I need to go check some labs for you, and I'll be right back, okay?
Okay, thank you.
You're welcome.
Now, this nurse didn't brush off the early signs and symptoms that the patient had told her. The nurse was able to ask if they were having any other symptoms and do an assessment to find any other signs and symptoms of dig toxicity. That makes her realize she needs to check the labs ASAP, meaning as soon as possible.
Oh, hey, Gabby.
Yeah.
Can you help me out really quick? Patient in room 204, her potassium's 3.0, her digoxin's 2.8, her BUN is 25, and her creatinine's 1.8. So I'm going to get an EKG on her.
Okay.
And so if you could call Dr. House for me and get him to come and help me with her so I can stay with the patient and get her leads on.
Yeah, no problem. I'll get that ASAP.
Okay, thank you so much.
Hey, Dr. House. This is Gabby. I'm a charge nurse on the tele unit. Could you come to room 204 stat? Nurse Alex believes her patient, Miss Wrinklebottom, is experiencing signs and symptoms of digoxin toxicity, and she may need orders.
Okay, I'll be right back.
Okay.
So what are you doing?
Oh, these leads are just to monitor the electrical activity in your heart right now.
That's good, because I know my heart doesn't work as well as it used to.
Yeah. I'm gonna listen to your lungs and do a full assessment on you right now, okay?
Something wrong?
Well, your labs this morning showed that your potassium levels are a little low, and we are concerned that this increases the level of your medication in your body. And if the medicine is too strong, we could run into some other issues. So I'm gonna do a couple assessments and see if there's anything else is off and see where to go from there. The charge nurse has already alerted the doctor, and she'll come in to see you soon.
Oh, well, thanks for catching that.
Of course.
I thought nothing of the nausea and cramps.
I know, that's common.
What's the problem?
Oh, hi, doctor. Okay, so Miss Wrinklebottom is a 50-year-old female, and she came in for exacerbation of heart failure and generalized weakness. When I assessed her, she had leg cramping and nausea. She later mentioned seeing halos and vision changes. I assessed her EKG and vitals and labs, and her potassium is 3.0, her digoxin was 2.8, her BUN was 25, and her creatinine was 1.8. So I recommend that we hold the digoxin this morning and maybe give her Digiband and potassium.
Okay, that's fine. I'll go ahead and put the orders in.
Okay, thank you.
Hello again. Here we have witnessed that when a prudent nurse is vigilant and uses her critical thinking skills, disasters are avoided. Patients remain safe. Digoxin toxicity can be an insidious process, and it is a nurse's duty to assess every patient complaint, monitor vital signs, and check the labs, such as the dig level, to eliminate any chances of adverse effects such as toxicity. Now Miss Wrinklebottom gets to go home to her 15 cats again. Good night.